have decided to choose the case study involving a 3-day-old baby. This case study really stood out to me as I want to study to become a pediatrician and work with kids. I am also expecting a baby boy next week, and I feel like as a new mom, you want to know and be prepared for anything that could ever go wrong or that could ever happen to your baby. Moving on to the logistics, in 2002 Journal of Perinatology, a neonatal transport team was called on a 3-day-old male infant. The parents of the child noticed that he had stopped nursing and became jittery and hypothermic. A little background on this, he was born early term at 37 weeks gestation to a 34-year-old woman. The pregnancy was uncomplicated, and the infant weighed 5 pounds 15 ounces at birth, and he was born via C-section. The baby had perfect APGAR scores, which he scored 9 when he was tested both times, which is pretty normal. So overall, he was a healthy newborn, your average newborn, until day 3. When day 3 rolled around and they were about to be discharged from the hospital, they noticed that his breathing was super noisy, and all 4 extremities were jittery, and he had lost 9 ounces from his birth weight, and his blood pressure was elevated. During this time, the nurses decided to take extra lab work. So the nurses took a plasma ammonia level, and it came back low. So it became evident that the newborn had suffered a severe pulmonary hemorrhage, which is bleeding from the lungs. Because of this, he was then diagnosed with hyperammonemia, which is most common among premature infants. And with hyperammonemia, it is extremely important to act fast, as if you don't, the infant will fall into a coma. And if this happens, circulatory collapse and cerebral edema are most likely to occur. Another thing that comes along with a coma is neurological deficits. Neurological deficits depends on the length of the coma. Those being mental retardation, seizures, cortical atrophy, which is somewhat like Alzheimer's, and also spastic quadriparalysis, which is like cerebral palsy but with all 4 limbs. Now, the neurological complications and the survival rate all depend on the length of the coma. Typically, neurological deficits occur if the infant is in a coma longer than 2 days. Typically, with hyperammonemia, plasma ammonia levels rise quickly within the first few days of life. This leads to a central nervous system depression and will eventually lead to a coma. Sadly, the cause of this still is unknown, but it does not appear to be genetic. Now, since hyperammonemia has been established, the plasma ammonia levels should be checked very frequently, as they could rise in a matter of time. Treatment-wise, there's not much treatment. There's therapy options. They normally typically place a central line to maintain fluids and to support the blood pressure. Next, they would begin hemodialysis, which hemodialysis removes ammonia from the body very rapidly. There's also maintenance therapy with hyperammonemia. So there's 3 parts to maintenance therapy. There's a protein-restricted diet, and there's supplementation with citrulline and arginine, and medication that gives waste nitrogen excretion an alternate route to leave the body. However, the specifics of the treatment and which one they would start in all depends on which enzyme is deficient, which basically means which enzyme is suffering in the body. When you're diagnosed with hyperammonemia, the patient should also be involved in physical, occupational, and speech therapy, as well as psychological and genetic counseling. All of these things are super important to do to maintain and make sure the hyperammonemia does not worsen. So in conclusion, hyperammonemia is a true medical emergency and should not be taken lightly. If your full-term infant ever shows signs of respiratory distress or poor feedings or noisy breathing or weight loss, typically newborns do lose a little bit of weight at birth, but if rapid weight loss, any of those signs, you should definitely consider getting plasma ammonia levels checked and added to the blood work, as you need to act fast. So that is it for this case study. Yeah, thanks.